detailed answers. So, what is the principle of a light microscope? So here we go. What is the principle of light microscope? So light microscope, it uses visible light and a system of lenses to magnify these small samples, and it operates on the principle of refraction and magnification. So what is the principle of microscope? Refraction and magnification. What are the different types of microscopes used in pathology? You can use light microscope, phase contrast, fluorescence, and electron microscope and polarizing microscope. Light, phase contrast, fluorescence, electron, polarizing. Five micro types of microscope. The electron microscope is very big, so it occupies the whole room. So it's such a big microscope. Okay. So light microscope, phase contrast. These are the simple one. Light, phase contrast. Okay. Fluorescent. What is the function of immersion oil in microscopy? So it increases the numerical aperture of the objective lens and minimizes light refraction, improving resolution. So it improves resolution. So use the oil immersion technique, right? Add a drop of oil, cedarwood oil, and oil in that. So it increases the numerical aperture of the objective lens and minimize light refraction, improving resolution. What is the importance of tissue fixation in histopathology? Importance of tissue fixation in histopathology. So tissue fixation, how it is important? So fixation preserves tissue structures, prevent autolysis, and hardens the tissue for sectioning. So tissue fixation in histopathology is important because it preserves the tissue structure, it prevents autolysis, and hardens the tissue for sectioning. What is fixative? Okay. What fixative is most commonly used in histopathology? We use 10% neutral buffer formalin. Formalin is used 10% neutral buffer. Coming to general pathology, what are the different types of degeneration? So there is a hydropic change, there is a fatty change, hyaline degeneration, fibrinoid degeneration, and amyloidosis. Amyloidosis. So this is the hydropic change. So hydropic change, fatty change, hyaline degeneration, fibrinoid degeneration, and amyloidosis. Okay. So hydropic change, fatty change, hyaline degeneration, fibrinoid degeneration, and amyloidosis. So it is the thing. So hydropic change, fatty change, hyaline degeneration, fibrinoid degeneration, and amyloidosis. So these are the types of degeneration: hydropic change, fatty change, hyaline degeneration, fibrinoid degeneration, amyloidosis. What is apoptosis? What is apoptosis? How does it differ from necrosis? ये समझ में आया? टाइप्स ऑफ डिजेनरेशन. हाइड्रोपिक चेंज मतलब पानी भर जाता है. फैटी चेंज, फैट डिपॉजिट होता है. हाइलिन डिजेनरेशन, हाइलिन डिपॉजिट होता है. फिब्रिनॉइड डिजेनरेशन, फिब्रिन डिपॉजिट होता है. माइलोइडोसिस, these are the improper folded proteins. Okay. uh, Hydropic, fatty, hyaline, fibrinoid, amyloidosis. What is the what is apoptosis and how does it differ from necrosis? I show the tabular form also. But apoptosis is a programmed cell death. apoptosis में क्या होता है? पूरा प्रोग्राम, पूरा प्लानिंग होता है सेल को किस तरह से मारना है. ठीक है. विदाउट इन मारना है. apoptosis is a suicide. Okay. So it is a programmed cell death विदाउट इन्फ्लेमेशन. तो जब सुसाइड होता है आसपास का माहौल एकदम शांत है. यू विल लर्न दिस इन फॉरेंसिक. सो इन सुसाइड कुछ नहीं होता. ओके. द एनवायरनमेंट इज वेरी क्लीन. ओके. द सराउंडिंग्स आर वेरी क्लीन. Nothing is bad. Okay. Everything is clean and clear. And if you see at the fan, there is a person hanging. So that is the suicide. So similarly here also, no inflammation, no inflammation, no disturbance, the cell is death. Whereas necrosis is uncontrolled cell death and inflammation. Necrosis is like someone is murdering the cell. So if someone is murdering means you will see inflammation. You will see inflammation. Okay. In apoptosis, it is like a suicide, self-suicide. So there is no inflammation. Necrosis, there is a inflammation, uncontrolled cell death. Apoptosis is a programmed cell death. The person will decide when it wants to die, what date, what time it wants to die. Okay, but in necrosis, it is uncontrolled. What is amyloidosis and how is it diagnosed histologically? So it is the deposition of misfolded proteins in tissues. It is diagnosed by Congo red staining with apple green bifringence under polarized light. Polarized light. Under polarized light. Under polarized light. So amyloidosis क्या है? How it is diagnosed histologically? Deposition of misfolded proteins in tissues. Tissues में misfolded protein होता है. Misfolded protein diagnosed by Congo red staining. Congo red stain करते हो polarized light के अंदर जब देखते हो तो apple green bifringence. Apple green bifringence देखने के लिए polarized light चाहिए. Differentiate dystrophic and metastatic calcification. Dystrophic occurs in dead and damaged tissues with normal calcium levels in the body. सो जब भी कोई डेड टिश्यू होता है उसमें डिस्ट्रोफिक कैल्सिफिकेशन होता है, नॉर्मल कैल्शियम लेवल्स होते हैं. मेटास्टैटिक इज लाइक कैंसरस हाइपर कैल्शियम, बढ़ा हुआ कैल्शियम रहता है ब्लड में. What is granuloma? A granuloma is a collection of activated macrophages, epithelioid cells, and multinucleated giant cells, typically seen in tuberculosis. So we have a lot many questions. Okay. So we are in granuloma. So granuloma is a collection. It is a collection of activated macrophages, that is epithelioid cells, and multinucleated giant cells seen in tuberculosis. In tuberculosis, you can see caseation also. Okay. What is the pathogenesis of atherosclerosis? First, there is endothelial injury, lipid accumulation, foam cell formation, and fibrous plaque formation. Okay. First, there is an injury to the epithelial cells. There is an injury. ठीक है. दिस है इंजुरी. अब इंजुरी होने के बाद क्या होगा? लिपिड एक्यूमुलेशन होगा. तो मैक्रोफेजेस विल एंगल्फ एंड बिकम फोम सेल्स. Then there is a fibrous deposition. So this is the atheroma formation. What are the causes of left ventricular hypertrophy? So this is your heart. So this is very thickened. Okay, this is left ventricle. Okay, this is left ventricle. So what is hypertrophy? Why it is becoming very thick? So because of hypertension, because the arteries have become very stiff, so it has to pump with more force. So that's why what happened, a very thick hypertrophy has been taking place, and aorta became heart or hypertrophic cardiomyopathy. There is a hypertrophy here, so cells have become very large in size. So because of hypertrophic cardiomyopathy. Okay. So aortic stenosis, hypertension, and hypertrophic cardiomyopathy. What are the hallmark features of bronchial asthma histologically? Histologically, bronchial asthma, you will see asthma, right? Mucus plugging, mucus will be there, lot of mucus. Subepithelial fibrosis, eosinophilic infiltration, hypertrophy of bronchial smooth muscles. Here, bronchial smooth muscles become hypertrophy. Because of that, there is a narrowing of the airways, right? So, hypertrophy of bronchial smooth muscles, mucus pluggings, subepithelial fibrosis, mucus pluggings, you will see a lot of mucus deposition, subepithelial fibrosis, eosinophilic infiltration, hypertrophy of bronchial smooth muscles. What are common causes of cirrhosis? Cirrhosis के causes है alcoholic liver disease, viral hepatitis B, hepatitis C, non-alcoholic fatty liver, non-alcoholic fatty liver, and Wilson's disease. So alcoholic एक हो गया, एक non-alcoholic हो गया, hepatitis हो गया, viral hepatitis, and Wilson's disease. These are the common causes of cirrhosis. What are the characteristic microscopic features of diabetic nephropathy? Nephro means nephrons, means kidney. So what are the characteristic micro features of diabetic nephropathy? So you will see diabetic nephropathy में you will find nodular glomulosclerosis, Kimmel-Steen Wilson nodules, mesangial expansion, and thickened basement membrane. Thickened basement membrane. Nodular glomulosclerosis. Nodular glomulosclerosis. So diabetic nephropathy में nodular glomulosclerosis you will see, that is Kimmel-Steele Wilson nodules, mesangial expansion, and thickened basement membrane. So the basement membrane will become very thick, and the glomerulus will undergo sclerosis, that is nodular glomulosclerosis, that is also called Kimmel-Steele Wilson nodules, and mesangial expansion. You will see the mesangial cells have been expanded. So in diabetic nephropathy means how kidneys are affected. So in diabetes, neuropathy is there, nephropathy is there, and retinopathy is there. Okay, because of neuropathy, there is a diabetic foot ulcer. Because of nephropathy, you will see these things. That is, basement membrane will become thick, mesangial cells will become expanded, hyperproliferation, and nodular glomulosclerosis. The glomerulus which is there, na, there you will get nodules formation and sclerosis. Cytopathology. What are the common cytological stains used in pathology? So you use Giemsa stain and Papanicola stain, and May Grunwald Giemsa stain. May Grunwald Giemsa stain. What is the Bethesda system in cervical cytology? Cervical cytology में Bethesda. So it is a standard reporting system for pap smear that categorizes lesions into ascus lesions, L-sil, H-sil, okay, and SCC. So this Bethesda system is for the standardized reporting system. It is the standard reporting system for pap smear. It categorizes lesions into ascus, L-sil, H-sil, and SCC. SCC is carcinoma. So what is the significance of coilocytes in cervical cytology? So coilocytes indicate human papilloma virus infection associated with cervical dysplasia. So if you are seeing coilocytes, there is association with cervical dysplasia. What is the utility of fine needle aspiration cytology? FNAP. It is a minimally invasive diagnostic procedure to evaluate lumps or masses in organs like thyroid, breast. So FNAC is fine needle aspiration cytology, very fine needle aspiration cytology, minimally invasive procedure used to evaluate lumps or masses in organs like thyroid, breast, and lymph nodes. For lymph nodes, breast, we do fine needle aspiration cytology. Difference between exfoliative and aspiration cytology. And exfoliative cytology, we collect naturally shed cells, example pap smear. While aspiration cytology, we extract cells using a fine needle. We extract the cell, खींचते हैं, aspirate करते हैं. Exfoliative means we collect naturally shed cells. Okay, naturally shed cells we collect. Clinical pathology में what are the normal constituents of urine? In urine you can find water, urea, creatinine, uric acid, and electrolytes. What are the significance of RBCs in urine? So in urine, if it is there, it indicates, that is, it is called hematuria. Urine in RBC 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 is called hematuria. It indicates glomerulonephritis, UTI, trauma, malignancy. Significance of RBC in urine. It indicates glomerulonephritis, UTI, trauma, malignancy. Glomerulonephritis, UTI, trauma, and malignancy. Okay. What is the significance of RBC in urine? That is called hematuria and it indicates glomerulonephritis. किडनी का प्रॉब्लम है, यूटीआई इन्फेक्शन हो सकता है, यूरिनरी ट्रैक इन्फेक्शन बिकॉज ऑफ ट्रॉमा और बिकॉज ऑफ द मैलिग्नेंसी. तो ब्लड इन यूरिन होने का कैंसर हो सकता है, दैट इज मैलिग्नेंसी. ट्रॉमा हो सकता है कि मार वार लगा है इस वजह से आया ब्लड, या इन्फेक्शन होता है यूरिनरी ट्रैक इन्फेक्शन, या फिर ग्लोमेरुलोनेफ्राइटिस, nephritis, itis, inflammation. What are the causes of nephrotic syndrome? Nephrotic syndrome क्या है? Minimal change disease, FSGS, membranous pathy, diabetic nephropathy. So what are the causes of nephrotic syndrome? Minimal change disease. What are the causes? Minimal change disease, FSGS, membranous nephropathy, diabetic nephropathy. What is the normal semen analysis criteria for fertility? So the sperm count should be more than 15 million per ml. Okay, and motility 40% should be motile. And normal morphology more than 4% should have normal morphology motile. Okay, so more than 50 million per ml sperm should be there. 15 million. Can you imagine? And among that 15 million, more than 40% should be motile. Among them, 4% should have the normal morphology. What are the characteristics of cerebrospinal fluid in bacterial meningitis? Bacterial meningitis, what are the characteristics? So, cloudy appearance, so it will be turbid, increased neutrophils, low glucose, and high protein. Hematology, what are the different types of anemia? Microcytic, macrocytic, normocytic. We can further divide it into detail. We'll discuss it. Microcytic, macrocytic, and normocytic. I think I'm live. So these are the important Viva questions. What are different types of anemia? Classification is important, not micro, macro, normo. You have to tell the proper detailed classification. What are Howell Jolly bodies? This is important. So these are the nuclear remnants in RBC seen in, these are the nuclear remnants in RBCs. Nuclear remnants. So seen in asplenia and megaloblastic anemia. In megaloblastic anemia and in asplenia, you can see megaloblastic because of the deficiency of folic acid, vitamin B12. The cytoplasmic growth is there, but the nucleus is not able to form properly. So because of that, there are some remnants in RBCs, nuclear remnants. So that is called Howell Jolly bodies. Is related to RBCs, asplenia. Okay. What is the mechanism of pernicious anemia? Autoimmune destruction of gastric parietal cells leading to vitamin B12 deficiency. Pernicious anemia because of the parietal cells are damaged because of it intrinsic factors are not formed leading to vitamin B12 deficiency. Autoimmune destruction is there of parietal cells. What are the so intrinsic factors from the parietal cells? What are findings in iron deficiency anemia on peripheral smear? Peripheral smear, you will see microcytic hypochromic RBCs with pencil cells. So in peripheral smear, in iron deficiency anemia, RBCs will become small. Normal shape should, normal size of the RBC should be equivalent to the lymphocytes. But then here it will become very small. It will become very small, and the color, the central pallor should be there. Na? 1/3 central pallor should be there. That is the RBC is totally looking pale. That is hypochromic with pencil cells are there. What is the most common leukemia in children? In children, all AL. ALL. How to remember this? Acute lymphoblastic leukemia. Small kids are like they want everything. They want everything. So all. So for small children, all ALL. Acute lymphoblastic leukemia. Autopsy pathology. What is rigor mortis? Rigor mortis is stiffening of muscles after that due to ATP depletion. Okay. What are the histological features of MI? MI coagulative necrosis. Okay, coagulative necrosis and neutrophilic infiltration and fibrosis. MI, you will see there's a coagulative necrosis, neutrophilic infiltration, and fibrosis. Virchow steroid thrombosis. What is Virchow steroid? This is very important. Okay, Virchow steroid is this endothelial injury, hypercoagulability, and stasis of blood. So it can lead to thrombosis if there is endothelial injury. Thrombus formation is possible. Coagulability state is more stasis. Okay. What are the changes in the liver in chronic passive congestion? Chronic passive congestion is there. If congestion is there and chronic congestion is there, the nutmeg liver appearance due to centrilobular congestion and necrosis. There is a centrilobular congestion and necrosis. There is a necrosis at the center. So it looks like a nutmeg liver. So it looks like a nutmeg liver. So it looks like a nutmeg liver. So nutmeg liver because of chronic congestion. So due to centrilobular congestion, due to centrilobular congestion, due to centrilobular congestion, due to centrilobular congestion, due to centrilobular condition, due to centrilobular congestion. What is the cause of basophilic stippling in RBCs? Basophilic stippling in RBCs because of sideroblastic anemia and lead poisoning. Lead poisoning and sideroblastic anemia. Lead poisoning and sideroblastic anemia. Okay, so there is a sideroblastic anemia. So it is because of chronic passive congestion. Okay, nutmeg is nothing but the jaifal. Jaifal is a spice. Okay, so it looked like a nutmeg because of centrilobular necrosis and congestion. Okay, centrilobular necrosis and congestion. What is the cause of basophilic stippling in RBC? That is because of the lead poisoning. So it is because of the lead poisoning and sideroblastic anemia. Sideroblastic anemia. So it is because of sideroblastic anemia. What are Russell bodies? What are Russell bodies? Russell bodies seen in multiple myeloma. Russell is a snake, okay? Russell bodies. So eosinophilic inclusions in plasma cells. Plasma cells have eosinophilic inclusions. Eosinophilic eosinophilic inclusions, eosinophilic inclusions, eosinophilic eosinophilic inclusions. Russell bodies are seen in multiple myeloma, multiple myeloma. So, what are the causes of eosinophilia? Presence of too many eosinophils in the body is called eosinophilia. It is eosinophilia causes are allergies, allergies. Okay. So, so Russell bodies means there is a eosinophilic inclusions. Eosinophilic means intense pink color. Pink color. Eosinophilic means pink. So if non-medical person if asks you what is your favorite color, you tell me eosinophilic. Eosinophilic color. Eosinophilic. Eosinophilic means pink color because the eosinophilic word comes from the eosin, which is pink color. Di-eosin. Okay. So pink inclusions are seen in plasma cells. So Russell bodies, round eosinophilic inclusions in plasma cells. Round eosinophilic inclusions in plasma cells. Eosinophilic inclusions. Russell bodies. Russell bodies are seen in multiple myeloma. So eosinophilic inclusions in plasma cells seen in. Okay. What are the types of Ladicious spleen. Ladicious spleen seen because of amyloid deposition. Because of amyloid deposition, there is a Ladicious spleen. Ladicious spleen because of amyloid deposition. Ladicious spleen. Ladicious spleen because of amyloid deposition. Ladicious means having a fat or waxy texture or resembling a lard. Okay. Ladicious spleen, ladicious kidney, ladicious degeneration. Lard means animal fat. So ladicious means fatty spleen. Lard means animal fat. It is a semi-solid fat, white fat produced, obtained from rendering the fat tissue. It is distinguished from tallow. Lard comes from the pork fat. Pork fat. Ladicious spleen is nothing but fatty spleen. What is the principle of Zeel-Lancel stain? So Zeel-Lancel stain principle is Zeel-Lancel principle is acid fast staining for Mycobacterium tuberculosis. Mycobacterium tuberculosis, there is a acid fast staining for Mycobacterium tuberculosis. Lepra also. What is the difference between lepra and Mycobacterium tuberculosis? If you are preparing for microbiology, you should know. These are slightly curved bacteria, okay? Straight or side curved. Whereas lepra, which is also a acid fast staining, these are having cigar bundle appearance. Okay, cigar bundle appearance they have. Okay, microscopy. What are the characteristics of Reed-Sternberg cells? Reed-Sternberg cells are seen in Hodgkin's lymphoma. So these are large binucleate cells with prominent nucleoli seen in Hodgkin's lymphoma. These are large binucleate cells with prominent nucleoli. So these are the large binucleate cells with prominent nucleoli. Large binucleate cells with prominent nucleoli seen in Hodgkin's lymphoma. Reed-Sternberg cells. Binucleate nuclei they have, and the large binucleate cells these are, and they have prominent nucleoli. So these are seen in Hodgkin's lymphoma. So they have large binucleate. So the cell will look like this. large binucleate nuclei, and the nuclei are very prominent. Nuclei very prominent. So this is called Reed-Sternberg cells, like the Mickey Mouse eyes. Like, okay. So these are the classical Reed-Sternberg cells. So large binucleate with the prominent nucleolide. What is the diagnostic feature of multiple myeloma in bone marrow? Sheets of plasma cells with clock phase nuclei. Clock phase nuclei. Multiple myeloma. Multiple myeloma, it is a plasma cell disorder. Okay, in bone marrow, you will see plasma cells, sheets of plasma cells with clock phase nuclei. Sheets of plasma cells with clock nuclei. You see Russell bodies in multiple myeloma. Russell bodies are eosinophilic cytoplasmic inclusions. Eosinophilic inclusions in the plasma cells seen in multiple myeloma. So plasma cells with perinuclear of and clock phase chromatin. So they have clock phase chromatin. Now let's discuss Samoma bodies. You can note down the details. Talk about multiple myeloma in detail. I will talk in few minutes, okay? Or maybe in the next video, because this is going to be a long one. So after completing this video, multiple myeloma, Russell bodies, sheets of plasma cells with clock phase nuclei. Sheet of plasma cells, clock phase nuclei. You can see Russell bodies. Russell bodies are eosinophilic inclusion bodies. Eosinophilic inclusion bodies. Okay, what is Samuma bodies? Samuma bodies is seen papillary thyroid cancers, carcinoma, and serous ovarian carcinoma and meningiomas. So Samuma bodies, these are seen in three things: papillary thyroid carcinoma, serous ovarian carcinoma, and meningiomas. So remember it like PSM, 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 papillary thyroid carcinoma, serous ovarian carcinoma, and meningiomas. So this is thyroid, butterfly retina, thyroid, ovaries, and meninges. Okay, so remember like this: PSM, papillary thyroid carcinoma, thyroid, ovaries, serous ovarian carcinoma, serous, and meningiomas. Meningiomas. Remember with this diagram: ovaries, serous ovarian carcinoma, papillary carcinoma of thyroid, and this covering is like meningiomas. Okay, what is the significance of SIA? This is the marker for colorectal cancer. This is CEA is a marker for tumor marker for colorectal cancer. What is the importance of ALP in pathology? Alkaline phosphate. Elevated in bone diseases, liver disorders, and biliary obstruction. So bone diseases, liver, and biliary obstruction. Gallbladder, biliary obstruction. ALP. What is the appearance of Giemsa stain in malaria? So ring form, you can see schizones, you can see gametocytes and plus of Plasmodium species. What is the use of HER2? HER2. What is the use of HER2 or NEO? in breast cancer? What is the use of HER2 or new in breast cancer? What is the use of HER2 or new in breast cancer? What is the use of HER2 or new in breast cancer? So, what is the use of HER2 or new in breast cancer? What is the use of HER2 or new in breast cancer? So, it predicts the response to targeted therapy. Like you can give trastuzumab for HER2 or new. Okay. What is Ascoff bodies? These are the granulated lesions in rheumatic heart disease. In RHD, rheumatic heart disease, you will see Ascoff's bodies. Ascoff's bodies. These are granulomatous lesions. What is the significance of Benz-Jones proteins? So Benz-Jones proteins, monoclonal light chains in urine indicative of multiple myeloma. One more thing is Benz-Jones proteins. These are monoclonal light chains proteins found in urine. Benz-Jones proteins. Benz-Jones proteins. Benz-Jones proteins seen in monoclonal light chains in urine. It is indicative of multiple myeloma. So I'll revise the points in multiple myeloma related to multiple myeloma. Multiple myeloma, what you will have sheet of, it is a malignancy of plasma cells. Okay, in plasma cells, there in multiple myeloma, there is a sheet of plasma cells with clock face nuclei. Clock face nuclei. You will see Russell bodies. Russell bodies. These Russell bodies have eosinophilic inclusions inclusions, and you will see Benz Jones bodies, that is monoclonal light chain in urine. What is the confirmatory test for syphilis? Confirmatory test for syphilis के लिए you do fluorescent treponemal antibody absorption. What is fluorescent treponemal antibody absorption? Fluorescent treponemal antibody absorption. 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 ABS means absorption. What is the most common benign tumor of the breast? Benign tumor of the breast is fibroadenoma. What is the function of P53 gene? What is the function of P53 gene? P53 gene is the guardian of the cell. So it is the tumor suppressor gene to suppress the tumors that regulates cell cycle